right away.
Right there.
Great, yeah. We return your time.
Yeah,
Okay,
absolutely.
good.
Thank you so much.
You're welcome.
Make sure you tell Rauner how nice we were. Good afternoon, everyone. We're going to begin by having Greg Harris explain the essence of the budget plan that was filed by both House and Senate Democrats today, and Jessica Basham will be available to answer questions. So Representative Harris.
Thank you, Mr. Speaker. I just wanted to briefly describe some of the high-level points from the House Democrat budget proposal that was filed today as an amendment to Senate Bill 6. And first of all, I want to talk about what our objectives were as we crafted this bill. We wanted to take into consideration all the best ideas from the proposal sent to us by the Senate Democrats. We reviewed and took many ideas from the proposal that was filed last week by the House and Senate Republicans. And we also considered the input that the House has had in hearings from members of the public in many dozen appropriation hearings all across the state, listening to what the public wanted us to do. We also had as a very key objective to accommodate requests of the governor in crafting our proposal by substantially reducing spending, living within the expense limits that he set forward in his budget, and also keeping within the framework of the revenue package that had been passed by the Senate, that the Senate Republicans and House Republicans said that they would support as a basis for their budget, and the governor indicated he would be supportive of that effort. So I'm very happy to say that in a year where currently the state of Illinois is spending $39 billion this fiscal year, we are on track to spend approximately $39 billion. The governor's introduced budget for next fiscal year, FY18, was $37.316 billion. The plan that was introduced by the House today spends $36.489 billion. So we are $3 billion less than current spending, and we are substantially under the governor's introduced budget, and we're very happy we could accommodate his requests. We would not propose in a revenue package to go beyond what the Senate proposed, a 4.95% individual income tax rate or a 7% corporate tax rate. We would support additional corporate tax loophole closures so that individual citizens who are paying their fair share would have the comfort of knowing that loopholes are being closed so that large corporations are also paying their fair share in Illinois. I'd like to tell you a little bit about the specific items that are in the budget. We would anticipate expanding the earned income tax credit to put more money back into the hands of working families and lower income families. We plan to fully fund all of our pension obligations. We are also open to considering several of the recommendations that the governor put forward in his plan for pension reform. And we plan to accommodate some of his requests. We fully fund group health for this year. We fully fund debt service requirements. We would add $350 million to the K-12 education budget to provide new resources for the evidence-based model. We would also provide another $65 million to the education budget to supplement the mandated categoricals for student transportation. So for districts which have heavy bus uses, long distance to transport students, there would be $65 million of additional relief for those districts. We would increase early childhood education by $15 million and add another $15 million for after-school programs. And we know that these are the kind of programs that during the summer and during the school year both, whether it's through a YMCA or a Teen Week program or Catholic Charities or Lutheran Social Services, keep young people off the streets and out of the way of harm and involvement in violence that unfortunately is becoming so prevalent. The Senate in their proposal had planned to reduce higher education funding by 10%. In our proposal, we only apply a 5% to higher education funding. So the universities would get 5%, would get more in our proposal. We would also fund MAP at the recommended level. We would add $41 million to community college programs. We would provide money for a living wage increase for care workers, for seniors, people with disabilities, mental health, and substance abuse workers. This is the issue you have seen, and many of you in this room have reported on, where our care system is collapsing and harm is being done to people with disabilities and seniors and mentally ill people because they cannot retain sufficient staff to work with those folks. We will fund community violence prevention programs, violence interventions, and diversion programs. This includes programs such as Project Ceasefire, Adult Redeploy, Youth Redeploy, as well as after-school programming, which I mentioned. We will also provide funding for youth jobs to give youth a positive opportunity instead of going to the streets this summer. We would provide additional funding for mental health and substance abuse services. We reappropriate capital projects that were previously appropriated. These would be statewide projects such as street and road programs. We fully fund the community care program for seniors. We know that the governor has proposed to make a major reduction and cut services for 36,000 seniors and move them into a lower grade program called CRP. It is still something that is a priority of ours to maintain them at the full level of services, and we fully appropriated for that. We have spent new money, and I want to tell you, sort of how we've come to this new money. There are no new programs in our budget. This is what I want to emphasize. There are no new programs. We have decided to supplement certain programs that already exist, such as violence prevention and services for the elderly, K-12 education, because these are things that people are really crying out for. And we've done it by reducing state bureaucracy. That is one of two ways. There is a 5% reduction recommended to the operations lines in state departments so that we can put that money into community-based services. And we are also transferring money that we have become aware that there are many new computer programming systems and software systems being invested in the state, $900 million worth of appropriation. We feel that some of that money would be better directed right now into the community and into our schools. We can invest over time in developing and expanding these systems, but right now in the crisis mode we're in, it's important to be sure that we provide the most to our neighborhoods. We restore welcoming centers and immigrant integration program for our immigrant and refugee communities. We restore the cuts to the emergency food program, teen parenting services, addiction treatment, supportive housing, respite care for DD families, parents of disabled children, the epilepsy program, and the autism program. We plan to increase funding slightly for the HIV/AIDS prevention and treatment, and also the breast and cervical cancer program as a cushion against what may happen in Washington, where cancer patients and HIV/AIDS patients undergoing treatment could lose access to health care should Congress pass the Trump care bill. So we want to be sure that there is some capacity in the state of Illinois so that people's treatment are not interrupted. So that's a brief summary of the bill. We are also contemplating clearly later a revenue bill, the traditional BIMP bill, and we are also discussing and hoping other caucuses will agree to find a way to pay down our backlog of old bills and bring the state back into some much better fiscal order.
Just numbers, 350 on education K-12.
$350 million additional to fund the evidence-based model.
65 million categoricals, what does that do to the proration?
Right now the proration is about 71%. I think this would get us up into the 80% range.
And finally, the supplementals, violence prevention, some of those, do you know how much total of new spending into current program?
I can get you those individual lines, John.
The 5% higher income, is that based on FY15 levels?
It is based on FY15 levels.
How long is the cap on property?
But this property tax bill is not part of this bill. This is a budget bill only.
Have you introduced a revenue bill?
We have not done that yet, nor have we introduced a BIMP or the borrowing bill.
How much in revenue are you hoping
It would be our goal to live within the confines of the revenue number set forth by the Senate in SB 9.
Would you keep service taxes?
I would just tell you that right now, we would live within the confines of SB 9. When we're ready to introduce the bill and we can display it, then we'll be able to say what all will be in it.
Republicans have talked about a spending cap. Is that going to be part of this at all? One-year spending cap, I think, was for $36 billion each year.
In this plan, we have a cap, which is called a budgeted amount, and we'll have that amount of revenue that's available to spend. It's a one-year budget. It would have 1 year's worth of revenue.
800 million less than what the government proposed. Can you quantify that, where that money?
Yeah, we're actually preparing a list, which we'll be able to distribute to you, of reductions, not only from the governor's introduction, but remember, we're spending at a rate of $39 billion a year this year, because of various court orders, because of continuing appropriations. So we're really trying to bring under control the amount of money that's going out the door, but it driving the available revenue into areas that are of the highest priority for the people of Illinois. I'm sorry? The backlog of bills will be addressed in a separate bill that would deal with the issue of borrowing to pay down the backlog. Also, it would deal with the unpaid balances of bills from FY17. There are a number of approaches that we're talking to different caucuses about. The idea would be to borrow to pay down the portion of the backlog of bills upon which we're paying 12% interest per year, and save $800 million a year in interest cost. And the way that would be saved would be the difference between the 12% and what we might be able to borrow at. But passing a complete budget is going to be very important, because I think the bond houses have already said very publicly that if we expect to come to market and borrow several $billion and we have not completed a budget with both expenses and revenues, it's not going to go well for us. That would be $36,489,000,000.
And how did Republicans respond to this plan in the meeting today?
Why don't you finish with Mr. Harris?
Can you again address the court orders? How are those impacted in this budget? Is that something that is being cut?
Well, here's the way the court orders work. The judges, and I think there's several judges. Consent decree judges, I'm lumping them into one category. I think when we did not have an appropriation, we were not spending, they came in and said we had violated their orders, which required a certain amount of spending appropriated each year to pay for certain critical services like Medicaid and DCFS and nursing homes and some others. I think that should we pass a balanced budget with revenue to support it, the judge would say, there is now enough money appropriated going out the door to provide for the services that I have required. And those consent decree, the court-ordered payments would be reduced at this point.
Can you verify, sorry, just the reductions in state bureaucracy, how much that would save, and also the computer programs, how much you're cutting?
I know that it is a 5% reduction to different operating lines, and we'll get you what that all totals up to.
Not across the board, then?
Well, again, there's some very small agencies where we say, you can't take 5% away from a two-person agency and expect them to manage. But when you look at the larger agencies with budgets that are in the billions of dollars, there's certainly much more flexibility, and we would lump sum the amounts that we were giving to the director so that they would have the maximum flexibility to manage their departments in the way they found most appropriate. They could manage, vacancies, let them go another couple months. They could reduce expenditures on, software or systems. We want to give them the maximum flexibility as managers.
Can you say what the pension payment would be and also what the group health payment would be?
Yes. So group health would be, let me get it on my sheet here. Group health in our proposal would be $1,858,000,000.
Does that cover the 2 years that
That
there haven't been?
is for FY18, the next fiscal year's liability. It would be the full payment for next year. As part of the borrowing and repayment plan that I discussed, it will be a separate bill. we would move all the unpaid bills from prior years, into that bonding issue so that they would be paid back for not only last year, but other years where there's not been adequate appropriation.
And notwithstanding any changes that the governor might negotiate with us.
Oh, yeah, you can always go down. You can always spend less, but you certainly cannot spend more. We are not counting on those savings.
And Monique's question about pension.
$7,394,000,000. $7,394,000,000.
Do you show that you're gonna have a surplus by spending 36 and going with the 4.95?
We are showing a teeny, teeny, tiny surplus, so I wouldn't go out and start spending any money right now. It's very small.
Are there funds?
There are no fund sweeps. Again, the idea of fund borrowing, as we look at how do we finish out FY17, for which there have been no appropriations, which will become a backlog of bills, and there's several $1 billion worth of unappropriated expenses we still have to account for from January 1st of this year till the end of this fiscal year. That would go into back bills. There's been some talk, could you do some, interfund borrowing to, reduce the amount of money we'd have to, otherwise borrow on the marketplace to pay down some of those. But there are many options we're looking at. We want to find the one that's going to be the best and the cheapest.
What is the living wage for Carroll?
That would allow increase over a couple years to raise the wages. And they right now, yeah, I can give you some of them. So, for instance, the ones that you hear about all the time would be the home service providers, folks who go in and provide home services to people with disabilities. The dollar amount there would be about $12.6 million. And I think those folks are earning, they're earning very low wages, $8 or $9 an hour wages, and what's happening is they're able to go and make rational decisions for their families and go find employment elsewhere at a much higher rate. So, we would, gradually over a period of years try to raise those rates $1 or so a year so that there'd be a little bit more competition. No, it is not straight to the 15. It is, we would like to get there, but we have a very gradual path. Well, we already do the earned income tax. We already do the earned income tax credit in Illinois. We would just expand it so there'd be more benefit to the families who participate. And there is a threshold to it, but I'll get back to you. I can't remember what it is.
Capital reappropriations, do you know the total there? And we were talking about reapprops from.
We're talking about if you were to go back to the stopgaps we had passed over the last couple of years, there are reappropes of major statewide capital and repair projects. There's some emergency repair money for the Capital Development Board and others. But the major projects that you think highways and building repairs and things like that.
I'm sorry if I missed this. What about the second half of FY17 for higher ed and social?
This is the backlog of bills that I said we're going to have to deal with. They've never been appropriate. This is about, the problem's going to be, and we won't know until, we've seen the totals, but it's going to be about a $2 billion problem. And if you remember and possibly more, in the Lifeline budget, we proposed to take care of this problem in advance before they became unpaid bills and earning interest and whatnot. We had looked at using two funds of the state, the Commitment to Human Services Fund and the Educational Assistance Fund, where money is just sitting that can only be spent for human services and higher education, but that bill never got called and never passed. So we'd start with those monies because that's money that's sitting there, it's due and owed to them. Then we would see what's the balance that's left to be paid that didn't cover and propose other ways to.
You're not saying that had the Lifeline budget passed, it would have cost $800 million or thereabouts to cover all those bills, and now that total is $2 billion.
No, I'm just saying of that $2 billion, there are about $800 million that could have been paid in the human service and Lifeline, or in higher education category in the Lifeline budget.
$2 billion is in
Because you also have other functions of state operations, departmental expenses, things that have accrued that are not covered by one of those funds that we're going to have to find the cash for somewhere.
Say as part of the backlog, probably then it would be the 15 billion in overdue bills plus a $2 billion.
I believe the comptroller is anticipating that $2 billion in her $15 billion. Okay, we have to.
So are you saying you're going to wrap it all together and try to borrow to pay that 6 months?
Well, there's been a theory put forward by a lot of people that it makes financial sense for the $15 billion of backlog bills. There is a significant portion of that, and this is a Senate Bill 4 that came over from the Senate, that there is a significant portion of that on which we're paying 12% per year interest. I mean, that's a huge amount, especially in today's market. If we were to take the amount on which we're paying the high rate of interest and go to the bond market and borrow that as a bond issue, we could probably get a rate of, last time we did these calculations, of about 4.5% interest in that vicinity. So just that spread alone would be a huge savings in interest that's going out the door. And we know that's about $800 million a year.
The people who don't have an appropriation, are they going to get one? Because like they can't even go to the court claims now. I mean, how
We would give them an appropriation for the last 6 months of FY17. Well, higher ed would get out of the higher education fund. We had there was, I believe, $445 million in there. That would certainly get distributed out to them for FY17.
higher ed cut? It was 10%.
It was 10% the kind. We have cut it last. We're at 5%.
How do you address the Illinois lottery? You know, it's a big concern with multi-state game possibly pulling out.
Well, again, I think they pulled out because they did not believe that our state was fiscally sound because we've been operating without a budget. We are hoping to pass a budget, prove that we are fiscally sound, and then get back into that program. We anticipate $300 million for the sale of the Thompson Center.
Speaker, you want to take a couple of questions? And then you don't get to answer that.
Don't get the answer what?
You don't get to answer my question whether you want to.
Okay, yeah, sure. Amanda, what have you got?
What do I got? I want to know, first of all, how serious of a deal this is. It seems like there's a lot in there that is contrary to some of the governor's biggest asks. It meets him in terms of the spending figure, but he's clearly put as a priority this computer program, the community care, et cetera. So is this designed as a compromise?
I think that Mr. Harris would tell you that this document was drafted in consultation with the Senate Democrats. He's had conversations with several House Republicans. Senator Cullerton would say that the negotiations that occurred between Senate Democrats and Republicans on the budget were greatly included in what Mr. Harris just described. So I'm not saying that this is perfect. I'm not saying that it completely meets every request of the governor, but I think that it goes a long way toward giving the state of Illinois a good, solid spending plan that responds to the real needs of the state, the real needs of the people of the state, and significantly is below the level of the governor's introduced budget.
Clearly, the Republicans have heard you say it's up to them to convince the governor. Did you get any sense from them today that this is something they can take to the governor and convince him to?
I reiterated my position to both Representative Durkin and Senator Radogno that we expect them to persuade the governor to be reasonable. You probably know in the House, we've been advancing bills and we've been advancing issues over the last several days that are designed to be responsive to the bills and the issues that were filed in the special session. So issues such as property taxes, pensions, government consolidation, workers' compensation. We are advancing those bills. Bills are scheduled to be called tomorrow in the House, which are responsive on all four of these issues. Our record is that we responded to the governor's call for a special session. We've been in session every day. The House has worked every day. We're now prepared to advance these bills, which are responsive to the governor's request. In the world of the governor, this is part of the budget making. Doesn't have to be part of the budget making, but in the world of the governor, this is part of the budget making. Mr. Harris has worked on the budget making. My view is that it's now the responsibility of the Republican leaders, Senator Radogno and Representative Durkin, to go to the governor, persuade the governor to be reasonable on these off-budget issues and on the budget document, which was prepared by Mr. Harris in cooperation with Senate Democrats and many Republicans.
In the world of the governor, he gets his way all the time. 90% isn't enough, and negotiation means give me everything. And you just hear him say, this doesn't go far enough, give me a clean bill.
Right, right. So this is a governmental negotiation, and I think you all know that in governmental negotiation, like negotiation in most other areas, nobody gets 100%. Everybody takes something less than 100%. Now, on these four issue areas that I just set out, property taxes, pensions, government consolidation, workers' compensation, the Democratic members of the House that have worked on these issues were asked to offer estimates of meeting the governor. And the estimates of what the governor would get would always be at least 50%, many times higher, sometimes up to 90%. The governor may disagree with those percentage estimates, but there is substantial compromise contained in the positions which will be advanced by House Democrats tomorrow.
But Republicans are already saying that you're hiding the ball because you're not introducing a revenue bill for this.
Well, I've said from the beginning, and I think that you would agree with me, and certainly your editorial staff would agree with me, that a revenue bill will be a joint effort. It's not going to be just one group of people. It's going to be a joint effort. And if Mr. Durkin and Senator Radogno are successful in persuading the governor to be reasonable, that would include Republican support for a revenue measure.
Did they indicate that they would be successful in that in your meeting?
Well, I think that they indicated that they were hopeful.
Is this the end-all, be-all, final bill that you feel like you've taken all of the input from the other caucuses, and so this is what it's going to be? Or is there room for more negotiation? And that is going to
Well,
happen?
I think you would acknowledge, based upon your short time here, that there's always room to talk, right?
Mr. Speaker, is there any movement on new reforms on work comp? Part of the
There are continuing discussions on workers' compensation. I think that the discussions to date have covered all of the issues that are normally discussed relative to workers' compensation.
Did House Republicans lay out where they stand on those four-issue bills that you plan to run tomorrow?
I think Mr. Durkin would represent that he's interested in working in these areas. You know, they have filed bills. They're familiar with our positions. They understand their positions. It's a question of negotiating. It's a question of understanding that you don't get 100% in negotiations, and that because of the governor, these have to be taken with the budget making. I've said on many occasions, since Mr. Rauner became the governor, Illinois has done 7 budget bills. We did 7 budget bills because the governor dropped these off-budget issues. But here we are again.
What assurances do you have, what level of confidence do you have from the Republican leaders that these bills will pass tomorrow?
We had a very calm and reasonable meeting today, and everybody understands the gravity of the situation. I think they understand that it's their responsibility to persuade the governor.
How do you take them saying that your effort to meet them is watering down these proposals?
My position is, number one, since Mr. Rauner became the governor, Illinois has done 7 budgets where he's dropped the turnaround agenda. Governor Rauner is the one who has held hostage the Illinois governmental budget making in order to get off-budget issues accomplished. That's been his plan, his exercise, not mine. And so I'm reluctantly agreeing to discuss these off-budget issues. I think that this could be done without the off-budget issues.
Have there been any further talks about the issues that you put on the
there were today, and I reiterate it today, that as far as I'm concerned, to finalize the impasse, why the governor must sign Senate Bill 1. There must be real rate regulation in workers' compensation, and the governor has to sign the Greg Harris bill, which would bring transparency to the procurement process on purchase of care. So the administration has been proceeding to do the largest purchase of care agreement in the history of the state of Illinois behind closed doors. And the Harris bill would open the doors, let people come in and see how we're going to spend the largest procurement contract in care since we got into this business.
Why on earth would you think that he would agree to those things?
Why would he not agree to open the doors to transparency on the purchase of care agreement? Why would he not agree that the insurance companies that sell workers' compensation insurance, where the evidence is beyond doubt that the savings from the 2011 bill have not been passed on to the purchasers, why would he not, as part of a total settlement, agree to sign a bill where his director of education said that he agrees with 90% of the bill?
For years, the Democrats have been talking about the workers' comp issue, and he's poo-pooed, dismissed,
Well, you know,
deflected.
I mean, I'm not in a position to speak for how Mr. Rauner thinks and why he does the
you're
things that he
demanding
does. Well, I'm laying this out as matters for discussion
You want a
in
budget,
the
he'll
budget.
never agree to them, and there won't be a budget.
Well, that's his decision. That's not my decision.
Are Democrats unwilling to vote on a tax hike ahead of next year's election?
We're prepared to be engaged with everybody that's involved in this process. I think everybody understands the problem. Mr. Harris has done a great job in preparing a budget document. The state needs more revenue in order to pay for that document and to balance the books. That's why we're here. We're prepared to work.
Are you working with some of your members to either convince them to go along with voting for a tax hike or to encourage them to be comfortable with that, particularly leading up to the election?
House Democrats have met in caucus every day that we've been in Springfield. House Democrats are thoroughly educated on all of the issues before the General Assembly, the budget making, the off-budget issues. They're fully educated. They're prepared to do what's in the best interest of the government of the state of Illinois and the people of the state of Illinois.
Thanks, everybody.